Hi everyone, my name is Erin Bielman and today we're going to be talking about what is a deep vein thrombosis, which is also known as a DVT. So what is a DVT? It's some kind of obstruction in the blood flow. It is more common in deeper vessels, so 90% of these cases happen to be in the legs. It happens whenever there's some kind of obstruction in the blood flow. You have more valves in your veins than you do in your arteries, so that's how they can get caught in these little pockets. This is the normal blood flow. This is where the blood is kind of stagnant. It's getting caught up on those valves right there. And if one of those little parts of the clot break off, that's when they call it an embolus. If that embolus can travel up to your lungs, that's where you get the term the pulmonary embolism. 1/3 of pulmonary embolism cases end up in mortality. So how do you get a DVT? There's 3 factors that can cause a DVT. One is stasis, venous stasis. So in congestive heart failure, when your blood flow isn't returning to your heart and it's kind of staying in that spot, when you cross your legs and blood's not going through there, you're immobile, so your blood flow isn't kind of moving around. That's what venous stasis is. Any kind of injury, so anytime you have any kind of trauma, surgery, any kind of change in the vasculature, that can cause an issue. And then some people are just more prone through genetics or hypercoagulability. So in conditions with factor 5, factor 8, Van Wilderben's, and then comorbidities such as obesity, diabetes, when women are pregnant, smoking, taking birth control. So you can just be prone to having more clots present. So what are the signs to look for? Redness, cramping, pain, swelling, any kind of change in that foot at all. Some people even have numbness and tingling as well in their toes. So all signs to be looked for. So how do you diagnose this? There's a couple different ways you can do this. Any kind of imaging will show you that. MRI and CT scan, especially with CT with contrast, so that you can see those visual changes. Something that you can do at the bedside, which is cost effective, and you can see right away, is an ultrasound. So here's a example right here. This is what normal vessels do. Whenever you put the probe on it and you push down, they're collapsible. When a clot is present, you'll see this little smush and you're not able to collapse that vessel. You can also do a blood test at the bedside called a D-dimer, and that level is elevated when there's a prominent clot present in the body. So how do you treat a DVT? You have a couple different options here. If it's inpatient, you have access to IV medications, so you can start them on a heparin drip. Severe cases of a PE, you can give them infusions of TPA. This will give them, make them a higher risk of bleeding, but that's why they're monitored in the ICU whenever they're given that. They can go to interventional radiology so that they can place sheaths and evacuate those clots. They can also be a candidate for an IVC filter, and it's placed actually right here in the groin, and it looks like a little strainer. So if you're prone to higher clots, or if you have an extensive clot that's present, it kind of helps filter the clot out of the blood so that it doesn't cause any later problems. So if you're outpatient, there's several different oral medications that you can be on. It's not just a standard aspirin or warfarin like it was 15 years ago. There's several different ones on the market. You just have to talk to your doctor about what the right medicine is for you. Examples of that would be Eliquis, Xarelto, warfarin. Some people even go home on Lovenox injections. So just talk with your doctor to see what's best for you. So how do you prevent a DVT? Most importantly, staying active, especially when you're traveling, long flight, in the car. Just keep moving. I know drinking a lot of fluids will increase that blood flow because you have more fluids in your body. Just be careful, especially if you're prone to congestive heart failure and you're on fluid restriction. If you're more prone to being a candidate with a clot, talk with your doctor about preventative medications that you could be started on. But most importantly, that communication with your doctor and finding the right solution for you is the most important thing. And here are my references. Thank you, everyone.